Hi, my name is Rhonda Mosley. Today I will be presenting for you chlamydia trachomatis. My audience and cameraman is my son. Okay, so let's get started. What is chlamydia? Chlamydia is a sexually transmitted bacterial infection that is spread through infected bodily fluids or secretions. The disease structure of it is a gram-negative bacteria, intracellular parasite with an outer membrane that is cocoid or rod in shape. How it starts. Chlamydia has two different stages. It has an elementary stage as well as a reticulate stage. The first stage, the elementary stage, it has elementary bodies that attach to a host, and the host, the bacterial adhesions, they snatch on and grab to the host receptors, which means that the elementary body form is not just yet active, so it needs a host in order to become active and grow. It is usually contracted through mucosal membranes, the moist dark spots, any kind of fluids to get that energy, that activation to be active. So inside the host is where it becomes active, and it's now called a reticulate. The reticulate uses the host as its energy source, and it's now ready to replicate and become infected cells. So once it's in its little pouch and the elementary bodies have become reticulate, they're all grown up, they're ready to burst out of their cells, and that's when they have infection in them and they are released and ready to infect other people. Who does it infect? Chlamydia affects anyone that is sexually active. Studies show that women between the ages of 15 and 24 are 2 times more likely of being infected than men in that same age group. 1 in 20 sexually active females have chlamydia. Infection rates are 6 times higher in African American females than in whites. Also, chlamydia affects gay and bisexual men as well. And this chart just goes to show that your black, non-Hispanic raciality is more affected so than any other race. How it spreads. Chlamydia spreads by, of course, being sexually active, more so in those who are under the age of 25. Having unprotected sex, of course, is very easily transmittable. Having multiple sex partners and having a history of sexually transmitted infection previously, you become more prone to getting chlamydia. And also, chlamydia can spread from mother to baby. And this is going to show that 7 in 10 women who have been infected with chlamydia, they have no symptoms. 5 in 10 men who have been infected with chlamydia have no symptoms. So that just, you can have it and not show symptoms, feel like you're A-okay, and continue to spread it and pass it along. So, signs and symptoms of chlamydia. For women, you'll have painful urination, vaginal discharge, painful intercourse, bleeding between menstrual cycles, and for men, you too can also have penile discharge, testicular pain, burning, and painful urination as well. Other complications can also be pelvic inflammatory disease, epididymitis in men, infection in newborns, ectopic pregnancy, infertility, reactive arthritis, and also you can also get conjunctivitis through contact with infected bodily fluids, such as the discharge or any type of semen, and just say you wipe your eye and you get that infection in your eye, causing that conjunctivitis in your eye, and you have chlamydia in your eye. The treatment plan for this infection, number one, there is no vaccine. There is not a vaccine for this infection. You go to the doctor and they more than likely prescribe you antibiotics, and you will take those biotics as they are prescribed for how long they are prescribed. Even if you feel like your symptoms are gone away or you feel like you don't have it anymore, take the pills, take those antibiotics as they are prescribed for as long as they're prescribed. The antibiotics that are most popular given are the azithromycin, doxycycline, tetracycline, erythromycin, and oxyfloxacin. Depending on any allergies that you have, the doctor will prescribe one of these type of antibiotics. So, in a nutshell, the conclusion to this: to stay chlamydia free and any other bacterial infections, practice safe sex, get screened routinely, and also you want to limit your sex partners. It is treatable, it is preventable, but it also staying safe at the same time is very important. Thank you for your time.